that question of whether or not government has taken the plight of healthcare workers seriously during COVID-19 or not. And let's get a view from the healthcare worker on the ground, Dr. Brenda Nemukongwe. She's a hospitalist who runs her own pathology labs called the Path Point. Dr. Brenda, good evening, and thank you very much for your time and joining us at this time. Healthcare professionals generally in a time of a pandemic, they come under severe stress irrespective of the duration of the pandemic. But more than that, there have been other issues that healthcare workers have had to deal with on the ground with COVID-19 in South Africa. Outline for us some of those challenges.
Good evening, Thabo, and thank you very much for having me on Newzroom, and good evening to your viewers. I think there's a lot of behind the curtains when it came to COVID-19. If I can just highlight quickly my role, I'm a histopathologist and I think laboratories received a lot of exposure during COVID-19, and it quickly seemed that laboratories were only doing COVID-19 tests, whereas there are many other things that laboratories were doing way before COVID-19 came into the country. And I mean, COVID-19 was just one of the tests, it's a molecular test that we were testing for.
Now, as far as, of course, the doctors themselves and the kind of anxieties that they were dealing with, particularly coming to work, and as you put it, they had to deal with other diseases, but, of course, COVID-19 was the main thing that many people were coming there for, and there was always this risk that they could get infected, but not only that, they could infect members of their families. How did doctors deal with that?
Okay, Thabo, I think for me personally, being married to a healthcare professional myself, we came under a lot of pressure because, you go to work and you get exposed to this virus daily. And come the issue back home to your houses, to your family, and deal with this thing. I mean, it's not enough that we came immediately into a shower before talking to your kids, change your clothes, shower, sanitize. There was a lot of emotional pressures involved with this, actually being worried about exposing the kids to this virus. Earlier on, when the lockdown started, we were in arguments with families deciding whether we should move our kids, whether we keep our kids at home. So there was a lot of emotional burden associated with the actual testing because we were exposed. I myself had to test 3 times during this pandemic. I think I went in and out of quarantine more than 5 times. So, I mean, the emotional issues that we had to deal with are still there. We had to, see colleagues pass away from this pandemic without much that we could do. I mean, our powers were really limited during this time.
Dr. Brenda, let me ask you to stay on with us. I'll tell you why, because we are joined now by another doctor as well, Dr. Gontse Gabanakgosi, who works in public and private casualty wards. Dr. Gontse, good evening, and thank you for your time and being with us today. So talk to me about what we are seeing in terms of the numbers. About 31,000 or so healthcare workers contracting COVID-19, but the majority of the cases are from nurses and medical doctors who are showing about 6% of that total having contracted the virus, and a majority of that 1,600 of the doctors actually coming from the the public sector, not so much from the private sector. How do you read those numbers?
Well, I think that, first of all, you read them with a bit of caution because the numbers at some point were not entirely correlating with the picture on the ground. Perhaps it's just my belief that far more healthcare workers were infected and they didn't just close, or it was very difficult for them to just close because public and private had different protocols and ways of doing this. So, for instance, like in KZN and earlier on during the pandemic, there was a lot of silencing of the health workers being told not to report to their other colleagues that they've tested positive and so on. So I think that our numbers were a bit skewed and relatively still are.
So, I mean,
The way I take
in
it,
your view on the ground, you say you've seen more health professionals being affected or infected even with COVID-19 than what is being reported. Tell me, do you think there was a flouting of procedures, particularly when it comes to the supply of personal protective equipment?
it's funny you say that because to give an outright answer, yes. So you'll remember that there's specific medical equipment that healthcare professionals should use because they're at far greater risk. So I think one from the top of my head would be the masks. So there's what we call the N95 masks and the KN95 masks. So the N95 masks are those orange ones that look like a duck. Those put a proper seal on your nose and mouth, and those are for medical use, and they protect you against viruses, as compared to the KN95, which is more used in industry and is for dust particles and has no protection against viruses. So we ended up using the KN95, both in private and public, by the way, because there was just such a shortage of masks and sanitizers, etc. So in terms of PPE, it's unfortunate that the virus came on a backdrop of an already struggling healthcare system, but with the added burden of the pandemic now, it just exposed so many discrepancies and flouting of processes and protocols by both systems.
How did this impact, and I'll ask you this question, and I'll also ask Dr. Brenda the same question, your decision-making in as far as the provision of healthcare services to patients? When you had, I mean, the House says it was either you complain, and if you complain, you get fired. I don't think doctors were facing that kind of a situation. But, of course, it was either you go in without the protection, or you would have to not go in and leave the patient to suffer. I mean, how did you make that decision?
So it's a very difficult decision. And because firstly, our oath and our nature is to do no harm. So our first instinct would be to jump in and try to save a life, because in some instances, every single minute counts. Now, when you are faced with the challenge that now you have to first dress up in proper PPE before you go save those lives, you feel guilty and you feel as though it is time wasting. So there's what some may call like a hero instinct, that you want to be a hero and jump in. But you are also part of a family. You also have loved ones. And there is a lot of implications to you yourself contracting the virus as a healthcare worker, because you go back home to a family, you've got family members, friends, colleagues, so no one wants to be infected.
Dr. Brenda, how did you make that decision for you? I mean, how difficult was it? Dr. Brenda, are you still there?
Hello?
Yes. Okay, I can hear you loud and clear.
Hello.
How did you, when it came to the decision of, do I wear PPE, do I just go in without protection, how did you balance that kind of a dilemma?
Thabo, it's a very difficult one. Like Dr. Gontse said, I mean, we saw the price of PPE just go very high. I mean, we in the private sector could barely afford the N95 masks, and we were really in the front line because we had a drive-through testing station, and you actually have to swab people there. And I mean, without the proper masks, we were putting ourselves at risk. Or some days you really have to decide what is more important in your life. And like he said, there's an oath that you took that you are going to protect, and there's a family that is on the line on the other side. But I would also like to put a twist to the story to say that, as healthcare professionals, when you actually get a family member test positive and the family member is lying in ICU, you now start thinking otherwise, because now you want healthcare workers who do not have PPE to actually attend to that person. So it's a very difficult decision to make, is an emotional decision to make, and it's a tough one. I had to go into work even on days where we could not actually afford the expensive PPEs, and I expected the same for my family members who got admitted. I expected that the doctors would go in and see them, even on certain days when we were told that the hospital does not have PPE. PPE was not delivered on time. And on that day, I was on the family side. I was not even on the healthcare side. And I got very upset to say, I mean, a family member is in ICU and I'm told that she will not be seen because there is no PPE for the healthcare providers. And it was very emotional for me to think about. I started rethinking that, look, if I don't go in to take a swab because I do not have an N95 mask, there is a family member on the other side. So I started having a different perspective of the whole thing. And unfortunately, our families had to take the fall and just know that we come back with the risk of contracting the virus.